Assalamualaikum and good afternoon, everyone. I'm Dr. Suriata binti Daud, family medicine specialist from Klinik Kesihatan Teluk Intan, Perak, a town with the Leaning Tower of Perak. I will present my research entitled Factors Associated with Sexual Transmitted Infections Among High-Risk Patients and STI Rates at the Teluk Intan Health Clinic from 2014 to 2018. STI client-friendly clinic in Teluk Intan was started in 2014 with focus on high-risk groups in the Hile Perak district. This clinic was started as part of the Teluk Intan Getting to Zero projects. So when I was transferred here in kkti Teluk Intan in 2017, I was surprised by the small number of patients at the STI friendly clinic. So this study aimed to make an impact on the performance of this STI client friendly clinic. STI is a great burden to public health. A study in the United States showed 19 million new cases of STI each year. So this study will evaluate the risk factors associated with STI in this community, the frequency of STI diagnosis, and the trend of STI rates from 2014 to 2018. Data were obtained from patients' medical record. It was a retrospective cross-sectional study. Convenience sampling was used and all the consultation between 2014 to 2018 were reviewed. The inclusion criteria were patients older than 18 years. A newly created data collection sheet which include demographic and STI risk factors were utilized, and then data were transferred to SPSS spreadsheet version 23, and then ethical approval were gained from MedRec, and the NMRR number was obtained. These are the results. This table show comparison between patients with STI and patient without STI diagnosis from 2014 to 2018 in terms of demographic, and then this table in terms of STI risk factors. The number of patients aged more than 18 years in the study were 193, and the median age was 40 years. Majority of patients were Malay between 21 to 59 years of age, female with secondary school education level and employed. The highest STI diagnosis was syphilis, which was 69.4%. This graph showed the rates of syphilis, gonorrhea, and HIV from 2014 to 2018. The chi-square test for trend was not significant with p-value 0.12. There was a low number of patients who attended this STI clinic. Several factors were found to be significantly associated with STI in Teluk Intan, which these were consistent with other studies. These factors are gender, age group, employment status, previous history of STI, high-risk behavior, condom use, and being victims of sexual and physical abuse. And there was no significant trend of STI rates for these three STI diagnoses from 2014 to 2018. Maud in Netherlands, Maud et al. Also reported a stable STI positive rates between 20 between 2006 to 2013 in Netherlands STI clinic. There were limitations in our study. This study collected self-reported data, which may lead to response bias. The sample size also small, and it used convenient sampling. The implication of this study are health workers in STI clinic in a small town like Teluk Intan should be vigilant in assessing these significant risk factors associated with STI, and further efforts need to be made by the clinic to promote this STI client-friendly clinic. And in conclusion, there was no significant trend in STI diagnosis found in this study, maybe because of the small number of patients in the study. The staff, clinic, and the stakeholders must review the effectiveness of the promotions of this clinic and the effectiveness of the STI preventive program in this community. And the preventive programs may need to address the significant risk factors associated with STI found in this study. These are some of my references. I would like to acknowledge and thank the Director General for his permission to present this research in this conference. My health officer in Hilly Perak district for his permission to conduct this study, and the FMSC committee uh, to for allowing me to present this research paper. Thank you very much.